Red blood cell count (RBC count). A red blood cell count is a blood test that your doctor uses to find out how many red blood cells you have. It's also known as an erythrocyte count. The test is important because RBCs contain hemoglobin, which carries oxygen to your body's tissues. The number of RBCs you have can affect how much oxygen your tissues receive. Your tissues need oxygen to function. Symptoms of an abnormal count. If your RBC count is too high or too low, you could experience symptoms and complications. If you have a low RBC count, symptoms could include fatigue, shortness of breath, dizziness, weakness, lightheadedness, particularly when you change positions quickly, increased heart rate, headaches, pale skin. If you have a high RBC count, you could experience symptoms such as fatigue, shortness of breath, joint pain, tenderness in your palms or soles of your feet, itching skin, particularly after a shower or a bath, sleep disturbances. If you experience these symptoms, your doctor can order an RBC count. Why do I need an RBC count? According to Association for Clinical Biochemistry and Laboratory Medicine, the test is almost always part of a complete blood count. A CBC measures all components in the blood, including RBCs, WBCs, hemoglobin, hematocrit, and platelets. Your hematocrit is the volume of the red blood cells in your body. Hematocrit test measures the ratio of RBCs in your blood. Platelets are small cells that circulate in the blood and form blood clots that allow wounds to heal and prevent excessive bleeding. Your doctor may order the test if they suspect you have a condition that affects your RBCs or if you show symptoms of low blood oxygen. They could include bluish discoloration of the skin, confusion, irritability, and restlessness, irregular breathing. A CBC will often be part of a routine physical examination. It can be an indicator of your overall health. It may also be performed before a surgery. If you have a diagnosed blood condition that may affect RBC count, or you are taking any medications that affect your RBCs, your doctor may order the test to monitor your condition or treatment. Doctors can use CBCs to monitor conditions like leukemia and infections of the blood. How is the RBC count performed? An RBC count is a simple blood test performed at your doctor's office. A healthcare professional will draw blood from your vein, usually on the inside of your elbow. They will then clean the puncture site with an antiseptic, wrap an elastic band around your upper arm to make your vein swell with blood. Gently insert a needle into your vein and collect the blood in an attached vial or tube. Remove the needle and elastic band from your arm. After collecting your blood sample, your doctor's office will send it to a laboratory for analysis. How should I prepare for an RBC count? There's typically no special preparation needed for this test, but you should tell your doctor if you are taking medications. These include any over-the-counter OTC drugs or supplements. Your doctor will be able to tell you about any other necessary precautions. What are the risks of getting an RBC count? As with any of the blood tests, there is a risk of bleeding, bruising, or infection at the puncture site. You may feel moderate pain or a sharp pricking sensation when the needle enters your arm. What is the normal range for an RBC count? RBC ranges are measured in terms of cells per microliter. Normal ranges for RBC differ based on age and sex assigned at birth. This is the normal RBC range relating to the adults, childs, and infants, and also the newborns. These ranges may vary depending on the laboratory or doctors. Ranges may also differ for those who are pregnant. What does the lower than normal RBC count mean? If your number of RBCs is lower than normal, you have anemia. This can be caused by a decrease in RBC production or by the destruction or loss of RBCs. There are many possible causes for anemia. Nutritional deficiency is the iron deficiency anemia, is the most common type of anemia, but lack of other nutrients can also cause your RBC count to decrease. These include copper, folate, vitamin B6, and vitamin B12. Bone marrow failure. In rare cases, your bone marrow might stop making new blood cells. This has caused aplastic anemia. Aplastic anemia might be an autoimmune disorder. Certain drugs, viruses, toxins, or radiations may also cause aplastic anemia. Hemolysis is the destruction of red blood cells. Common causes of hemolysis include autoimmune reactions to blood transfusion, infection, and inherited conditions like sickle cell anemia. Chronic conditions include underlying health conditions that cause inflammation may affect the way your body processes erythropoietin. EPO is a hormone that causes bone marrow to produce RBCs. EPO is produced in kidneys. If you have chronic kidney disease, you might produce less EPO than normal. Other chronic conditions that may cause a low RBC count include autoimmune diseases like rheumatoid arthritis or lupus, infections like HIV and tuberculosis, cancers, leukemia, myeloma, IBD including Crohn's disease, and ulcerative colitis.